Hello, my name is Stephanie Oliveris, and I will be covering opiate addiction in older adults along with Caitlin McNutt and Emily Wilfong. So, opiates are basically receptors that decrease the intensity of the pain reception through the spinal cord and brain receptors that inhibit those areas. So, the medication can also play a factor in the area of the brain that controls emotions, and areas that are part of the pain perception include the thalamus, periductal gray, insula, and anterior cingulate. The ventral tegmental area and nucleus accumbens are part of the reward feeling. Um, the amygdala is involved with emotions that are the reaction to the pain, and the brainstem nuclei regulates breathing. So, most recently, opiates have been used to treat acute pain, and in the 1990s have been increasingly used for chronic pain. So, more than 30% of Americans have acute or chronic pain. Older adults have more than 40% of prevailing chronic pain. So, acute pain would be like dental work or burns and cuts, while chronic pain would be like cancer or fibromyalgia pain. Uh, the treatment now of opiates can also trigger reward areas um, of the brain, making the person become high or the feeling of euphoria. So I'm sure you guys have heard of people feeling euphoria on like other drug substances like ecstasy or stuff like that. So opiates have a similar chemical make as to heroin. So it's another euphoric feeling for addicts, I guess, which makes it more of a risk for addiction and overdose for those who misuse their medication as prescribed. Um, Types of opiates include codeine, fentanyl, hydrocodone, hydromorphone, methadone, morphine, or oxycodone. Um, Opiates can also cause the person to feel mental confusion, constipation, drowsiness, nausea, and respiratory depression. So, respiratory depression is the slowing or stopping of breathing. Um, they act upon the opiate receptors in the protein that are found on the nerve cells in the brain, spinal cord, and other organs in the body. So I'll just go back again to the following picture. Prescribed opiates can be effective when used properly to avoid the risk of addiction or overdose. Short-term use for oral surgery for a few days would rarely lead to addiction versus taking opiates for weeks, which causes dependence, tolerance, and maybe addiction. So addiction is when they intentionally keep using to feel that reward or relief from the substance, what they are doing. So many healthcare providers are becoming more weary of the situation to prescribing opiates for chronic pain. Opiate addiction varies from 3 to 26% for chronic pain because of the differences in treatment duration. In 2002, 259 million prescriptions were written for opiates, and that is basically like if you give every American their own bottle of pills. So, more than 80% of older patients around the ages from 57 to 85 years take at least one prescription medication on a daily basis. Then more than 50% take more than 5 medications. So, adds up. The Department of Health and Human Services, Substance Abuse and Mental Health Services Administration reviewed that the abuse of opiates was then increased in 2014, then 2002 among the adults aged 50 and up. Um, the percent of aged 50 and up adults are at a 2% of opiate misuse. Physicians are finding that opiates are hurting more than helping when they prescribe older patients for chronic pain such as arthritis, cancer, neurological diseases, and other illnesses. It showed in a study of Medicare recipients in 2011 that about 15% were prescribed an opiate and that 42% were still using the prescription 3 months later. So just keep in mind again that Medicare means that they are 65 and older. And in 2009, it was encouraged by the American Geriatric Society to use opiates for moderate to severe pain. The panel assumed because they were older, they would not become as addicted as younger adults. But Dr. Mel, a medical director of the Las Vegas Recovery Center, stated there is no factual scientific basis for that. The drug takes over the brain. It doesn't matter how old the brain is. And over the past 20 years, the rate of hospitalization among seniors have quintupled because of the opiate misuse.
Drug addiction, but more specifically, opioid addiction, is a growing crisis in our country. When many think about drug addiction, they picture drug deals taking place on the streets. However, most people who become addicted to opioids get hooked from prescriptions, from legal prescriptions. An increasing number of older adults are becoming addicted due to the high numbers of prescriptions they are given. In 2012 alone, more than 700,000 adults ages 45 to 84 were hospitalized for opioid abuse. Even with these high numbers, addiction in the older population often goes undiagnosed. Many of the research studies that are being done on this topic are in younger populations, so not a lot is being done to help those who are older and may have addiction problems. So as Stephanie mentioned earlier, here's a list of some commonly used opioids. Morphine can be especially harmful to older adults who have comorbid diseases such as diabetes, hypertension, and congested heart failure. These conditions can affect the kidneys, leading to a buildup of morphine in the body, and these diseases are common in older adults. Oxycodone is better on the kidneys than morphine and similar drugs, making it preferred prescription for older adults. So that one, even though it's an opioid, is seen as a less harmful opioid than some of the other options. Meperidine is not recommended for chronic pain, especially in the older population. Has the potential to rapidly accumulate in patients, especially in those who have impaired functioning. So that again leads back to the comorbid diseases. If they have an issue that's going to impair their functioning, adding an opioid on top of that can really just devastate the body. Older adults have certain risk factors that can lead to opiate addiction that make them especially vulnerable. One vital factor is a lack of knowledge about the long-term effects of opioid use. This isn't just in older adults, this is across the board. Not a lot previously was known about exactly what opioids did to the body with long-term use. It was just seen as drugs that could help relieve pain, so it was being prescribed in a huge quantity for a long time. So only recently have studies come out about the negative effects of long-term use and the addictive quality of the drugs. Previously, many prescriptions were given out for opioids due to their ability to successfully relieve pain, but now many doctors and medical organizations warn against long-term use of such medications. So as we are getting educated about the effects, medical professionals are coming out and warning people about what long-term use can do to someone. but warning them now doesn't help those who have been addicted or have been on these medications for years, or those who rely on them. So it seems as though doctors still continue to prescribe opioids in large quantities. And this could be because they don't want their patient to be in pain. And if the medication can provide them some relief, they're going to prescribe it to them. This is understandable, because especially when it comes to older adults, because you don't want them to be in pain. And if you have something that can help them out, you're going to give it to them. And then in addition, a lack of monitoring of med dosage is also an issue for the older population. Side effects and dosage needs change as a person's body changes, and aging is a primary example of change. For those who have been on opioids for years, doctors often refill prescriptions without reevaluating what the patient actually needs. In addition, oftentimes people are given more medication at one time than they actually need. So specialists recommend providing opioids for a short period of time with careful monitoring. And then after the side effects and the effects in general are reported, refills can be provided on an as-need basis.